I'm Diana Steele, and I'm here at Fresh Street Market in West Vancouver, and today I want to talk about gestational diabetes. If you are a pregnant woman who is overweight and over the age of 35 and maybe has diabetes in her family, or if you're Asian, Hispanic, or African, you may be at risk for gestational diabetes. Gestational diabetes is a diabetes that happens during pregnancy where your body isn't able to produce enough insulin to handle the additional stress of having an infant or a fetus, as well as the change in hormones. And as a result of not producing enough insulin, your blood sugar levels increase after eating carbohydrate foods. If your blood sugar levels are consistently high during pregnancy, those extra sugars go to the fetus and cause a large baby. And so that would cause some difficulties in delivery later on. Your baby will never get the diabetes when it won't be born with diabetes, but you are at greater risk of developing type 2 diabetes later. As well, if you have another pregnancy, there's risk that you develop type 2 or gestational diabetes again. So there are some things that you can do in terms of dietary management so that you don't have to go on the medication or take insulin. Sometimes you do have to, but there are some things that you can think about with food. And the first thing to think about is try not to have all of your meals in sort of 3 large meals. Try and space them out into 3 smaller meals and little snacks. By reducing the total glycemic load or carbohydrate load, the amount of carbohydrates at one sitting, your body can tolerate that smaller amount of carbohydrates more easily. So thinking about having breakfast, a smaller breakfast, a snack, a lunch, a snack, a dinner, and a bedtime snack. The other thing to think about is your total carbohydrate intake and spacing it out. So rather than having, 2 sandwiches at lunch, consider having maybe only 1 sandwich. And when you're having your grain products, really focus on whole grain. The higher the fiber, the better. Fiber slows the absorption of the carbohydrates, which will slow the increase of your blood sugar levels and allow your body to deal with it as it comes, just with that small amount of insulin that you are actually producing. So choosing whole grains and having more fiber is really important. You can also fill up on leafy greens, and leafy greens are very low in calorie, but they also have fiber, which is going to help to fill you up and slow the absorption of your carbs. The other thing that helps slow the absorption of carbohydrates and sugars is protein. So having lean protein, whether it's nuts on your breakfast cereal or chicken on a salad or in a sandwich, or having beans or lentils in your pasta sauce, that will really help slow the rise of blood sugars and also create a feeling of satiety or fullness, so you won't eat as many calories. The other thing you can do is reduce your total sugar. So things like syrup and jam and honey, anything that's got added sugar in it. Choosing things like yogurts that are unsweetened. So go for your plain yogurt and maybe even a plain Greek yogurt so that you get the extra protein in there with not a lot of extra carbohydrates in there, just the normal lactose that you would find in a milk product. You can still eat your fruit. You don't have to eliminate fruit, but don't have 3 bananas at once. Just have the 1, or maybe even have half, depending on what else you're eating it with. As well, watch your starchy vegetables. You should still be able to eat carrots and corn, but I wouldn't have carrots, beets, and corn all at the same meal, because that's a lot of starchy vegetables. Remember, the starchy vegetables are converted into sugar, which cause your blood sugar levels to rise. And finally, emphasize your good fats. You do need fat, and actually DHA, which comes from fish, so canned salmon, for example, is going to be an excellent fat for brain health for your infant. So making sure that you're getting your DHA, and fats also help to slow the absorption of your carbohydrates. Try and exercise regularly, and if you do happen to have a large meal, it's a great time to go for a walk outside, and just make sure that you're planning ahead. If you have snacks on hand and meals prepared, especially when you're feeling a little bit fatigued, if there's a salad that's